right, let's go ahead and get started then. So again, buenos dias, good morning, everybody. Thank you so much for joining us on Somos el Cambio. We are the Change LatinX Mental Health and Wellness Virtual Summit, day 2 on a Friday, November 13th. We're super excited to be here with you all again. If this is your first day, bienvenidos really to our virtual summit here. Let me advance our slides. So my name is Michelle Linares, and I am a senior manager with our National Office of Equity, Inclusion, and Diversity at Kaiser Permanente. But I'm also the chair of the KP LatinX Association as well, which is a business resource group, or you might also recognize it as an employee resource group. And we're just a group of employees and physicians who serve as cultural brokers to our organization to help advance equity and social justice, and whether it's in the workplace or in the care delivery space that we provide care to our members, or the communities that we serve as well. So we are just one of 10 business resource groups that we have at Kaiser Permanente that's working to really strengthen our partnership and again, advance equity and inclusion at Kaiser Permanente in the communities that we serve. We're super excited to be part of this journey with you all around mental health and wellness in the Latinx community with amazing speakers that we have. My years at Kaiser Permanente started as a health educator, and I couldn't stress how much the importance of having a partnership with mental health clinicians was in order to make lifestyle changes in some of the patients and members that I provided education on, diabetes and other topics, just to name a few. So super excited to be here with my partner as co-leads to Jessica, and I'm going to turn it to her to introduce herself as well.
Buenos dias, everybody. My name is Jessica Dominguez. I'm an LMFT. I am the lead clinician for a culturally responsive program called La Clinica out of Kaiser, Richmond, California. And I'm also a very proud ambassador for KPLA, the mental health ambassador. Again, I'm just so grateful that you're taking the time to be with us today. And before we get started, I just want to acknowledge that we are on stolen land. And it's important that we pay respect, especially in the process of growing and learning and living. We need to acknowledge that. My home here in Oakland, as well as the headquarters of Kaiser, are located here in Oakland, California, where we are on Ohlone, Chochenyo, Muwekma land. And I just really want to acknowledge that and call that out, especially today. As Michelle noted, it's Friday the 13th, which is actually symbolic for the divine sacred feminine. And that Friday the 13th has been co-opted a lot by the patriarchy and turned into something very negative. But it's the day where we celebrate feminine energy and creativity, learning, growing. It means going internal. And I'm so grateful that we're doing this today on Friday the 13th and really channeling our creativity, our growth, and learning from one another in hopes of supporting the communities we serve and supporting ourselves, because we are the communities we serve. So muchísimas gracias for being here today. And I'm super excited to get started.
Yeah. Okay, Jessica, you want to walk us through the day?
So this morning we have some of our Kaiser Permanente leadership. We'll be hearing from a few of our leaders a little bit about what they've been working on, and also about just a little specific to each one of them, but really geared towards mental health in general and what Kaiser Permanente and leadership is doing towards mental health. And we're also going to be moving in, hopefully seamlessly, into our feature presenter around 10 o'clock this morning. We have Dr. Manuel Zamarripa, who is joining us from the Institute of Chicano y Chicano Psychology. We'll have a short break, but before that, we'll actually have a fireside chat from 12 to 12:30. And our break will actually come after the fireside chat from 12:30 to 1. We hope that that's the time where we can stretch, get something to eat, check on our kids, check on our pets. And then from there, we will move into our afternoon workshops. We have 3 different options from 12:30 to 1:30. And we have those options laid out. And we'll bring this information up periodically throughout, so please don't feel like you have to read the entire slide. And then following that, we'll have a second set of workshops from 1:30 to 2:30. And I know it's really hard to choose, but we also want to put it out there that everything is going to be recorded. So if you feel torn that you can't quite make a decision, don't worry. We'll have access to the recordings later on, so you can feel free to watch them all. And we hope to also offer some time for some connection towards the end of the day, especially now that we're almost all of us in a virtual world. It can feel very isolating, and it can feel very like we're all just in our respective spaces doing things alone. So we really wanted to carve out some time for some connection. And so towards the end of the day, we have some time that we've called Cafecito and Connections, just so that we can break out and connect with other people and just hopefully convivir un poco, debrief a little, and maybe connect. So thank you again for joining us, and we'll be going through the overview of our program throughout the day, especially with our regards to our workshops. Thank you. And I just wanted to note, our summit is being offered free of charge today, which is amazing. And we're really, really grateful to be able to provide all of this wonderful content to you free of charge. But we are highlighting 3 of our community organizations, specifically La Familia Counseling, Instituto Familiar de la Raza, and the Latina Center. And these 3 organizations, we're hoping that if you would like to make a donation to these 3 organizations, we're happy to receive anything that you'd like to share on their behalf, because they're doing great work for the Latinx community throughout the Bay Area, and we really want to help support organizations who partner with us and who really help us support our Latinx community and their mental health, their wellness, and their overall bienestar throughout the community. So muchísimas gracias if you can give. We appreciate it.
We also want to take the time right now, instead of normally waiting till the end, to thank our partners across the organization that has been making this happen over the last week and today as well. Starting on the left with sponsorship from our Northern California Office of Equity, Inclusion, and Diversity, and also the CE sponsorship partnership with our Mental Health Scholars Academy and Mental Health Training Program to be able to provide those CEs to our feature presentations and workshops. And also just our amazing volunteers that we have, Julia, Maria, Miriam, Natalie, Percy, and Wendy, who've been just behind the scenes last week and today to be able to provide and answer all those questions, record our workshops, and just be there with you all. As you can see, there are our own mental health clinicians as well, who are part of this journey of putting this summit together and being there and answering any of the questions. So miles de gracias to our partners and our amazing volunteers as well. We're going to do a little exercise, learnings from last week. As Jessica mentioned, we will have numerous slides where we will remind you which workshops we have available for you all. We want to also emulate the fact that in person you would register for one workshop, but maybe decide to go to another one on the day of. So we want to provide that option through the Zoom breakout rooms. And so on the left, you see the 2 segments that we have workshops outlined. And so when we get ready to do these workshops, you will see a pop-up message allowing you to choose one of these workshops. And which is why we wanted to stress that you upgrade to Zoom 5.2 or higher to be able to see this feature on the Zoom breakout. Now, if you don't see that, we have it just in case instructions that we can go ahead and take the time to do right now, just spend about a minute. If you can locate the participants icon and hover over your name, you'll see an option of more. And if you click on that, you'll have the option to rename yourself. This is good, especially if you're calling in from your phone also, or if you're calling in and you might get a numeric name attached to your participant name there, so you can actually rename yourself there. But we're asking folks to put in parentheses which workshops you would like to sign up for. for this afternoon. So we can get ahead and make sure that you are placed in the right workshop should the pop-up message for the breakout rooms don't show up from your end. So we're going to go ahead and give a minute here for folks to rename themselves and choose one of the workshops that you'll be attending this afternoon. You can see in the bottom right that, for example, I would be going to workshop B and then workshop C for this afternoon. If you are not planning to attend any of the workshops, don't worry. You don't have to do anything from your end unless you want to rename yourself. But if you're attending one of them only, you can also just make sure you put none, right, in front of, you know, which workshop segment that you're part of. So let me go ahead and check here and see if folks have renamed themselves so we can get a pulse from folks. If you want to go ahead and take the time to do that right now, I am going through the list and seeing, okay, thank you. I see some folks already putting in the workshops that they want to join this afternoon. And again, we'll remind folks which workshops is which throughout the day, but we want to make sure we do this exercise now for folks to prevent any delays from going into the workshop. So I see some folks already renaming themselves here. We'll give a few more seconds just to do this exercise. Again, go ahead and locate the participant icon. It's usually in the bottom of your screen where you see the chat as well. And you right click or you hover over your name, click on more, and then you'll see the rename option. And so go ahead and rename yourself by adding the workshops you'd like to attend this afternoon in parentheses. So thank you, folks. I see it. Diana, thank you so much for changing that. There we go, Patricia. Okay, great. So again, we'll bring this slide up again, but we wanted to get you all warmed up to this exercise so we can have a smoother transition for the Zoom breakout rooms. Okay. All right, let's continue with the show here, and I'll turn it now to Jessica to introduce our next speaker.
All right, everybody. So our first speaker for today is Dr. Humberto Temporini. Dr. Humberto Temporini is the Assistant Physician-in-Chief of Human Resources Physician Wellness and Development at the Permanente Medical Group. He's also the Associate Chair for Northern California's Regional Mental Health and Wellness. Dr. Temporini graduated from the Universidad de Salvador School of Medicine in Buenos Aires, Argentina. He moved to the United States in 1994 to attend graduate school at the University of Minnesota. In 1996, Dr. Temporini started psychiatry specialty training at Mount Sinai Hospital in New York City, from where he graduated in 2000. Dr. Temporini then went on to pursue a fellowship in forensic psychiatry at Yale University School of Medicine. In 2001, he joined the faculty of the University of Connecticut School of Medicine's Department of Psychiatry. For the next 5 years, Dr. Temporini practiced correctional and forensic psychiatry in Connecticut. In 2006, he joined the Law and Psychiatry Division at the University of California Davis School of Medicine, where he remained until 2010. During this time, he acted as an expert witness in multiple cases that addressed the interface between psychiatry and the law regarding issues such as competency, criminal responsibility, and diminished capacity, both in Connecticut and in California. Dr. Temporini was a consultant for the Connecticut State's Attorney's Office, the Connecticut Office of the Public Defender, and the United States Federal Public Defender's Office. He also served as an expert witness with the California Attorney General's Office and the United States Army. Dr. Temporini had the opportunity to collaborate with the Connecticut General Assembly on matters ranging from gun control legislation to the management of mental illness in prison populations. In May of 2010, he joined the Department of Psychiatry at Kaiser Permanente, South Sacramento Medical Center. He was attracted to the medical group's philosophy of care, one that embraces prevention and an integrated approach to the person's care needs. Dr. Temporini believes that attaining and maintaining mental health should be a collaborative process between a patient and physician and or their mental health provider. Let's welcome Dr. Humberto Temporini.
Good morning, buenos días. for everybody that's in this amazing meeting. Thank you so much, Jessica, for the introduction. Honestly, when I hear that, I forgot that I had done a couple things before coming to TPMG. But here I am. So you heard a part of who I am, which is a little bit more the professional side. So I'm going to talk to you a little bit about what is it that we're doing, at KP to ensure that everybody has access to mental health care. Did you know that in the US, the only group of people who have a constitutional right to medical treatment, including mental health treatment, are inmates? That's right. Nobody else has a right to receive treatment except inmates. Well, we don't think that you should be in jail to be able to receive the kind of treatment that you need. We think that everybody should be able to do that. I'll come back to that. I'll tell you a little bit more about myself. So as Jessica said, I grew up in Argentina. When I was about 7, 8 years old, I wanted to play the piano. My dad didn't think it was a pretty, masculine pursuit at the time. So he said, you should play rugby, which is like a manly sport, right? So that's cool, that's great. Years later, I think my dad was not so happy with the outcome, as my first boyfriend was one of the guys in my rugby team. So I think that the way things worked out were not what he expected. But the point is, that's basically part of who I am. And so I am no different from many of our Latino folks that are basically here in California. I'm a man, I am gay, I'm Latino, I'm a psychiatrist, and I'm an advocate for my community. And I make sure that we are able to provide that care that our organization believes should be provided to everybody, to every single person that comes through our doors, particularly when it comes to our Latino folks that are so underrepresented and underserved in when it comes to the care that they receive. So my first job when I finished my fellowship was, as Jessica said, was in a correctional facility. So this is a very interesting place. I was the psychiatrist at a female correctional facility in Connecticut. Turns out that Connecticut has prisons and jails are all together. So if you were a woman and you were arrested in Connecticut, or basically a woman or a trans woman actually, and you were arrested in Connecticut, you'll be taken to this facility, whether you were arrested for a DUI or for something much more serious. So every single woman that would get arrested would come to this facility where I worked at. And one time I was asked to evaluate somebody who was from Colombia, who was basically very depressed, and she was crying. And so people, couldn't really talk to her because they didn't have too many Spanish speaking, employees. And so they asked me to talk to her. And so I met this woman who was extraordinarily sweet, and she, asked her, how come you're in prison? And what happened, this is around the 2000s, early 2000s, when there were massive raids for undocumented people who would be working in a place like Walmart. And in this case, this woman worked for Sikorsky Helicopters, which is a national defense contractor that happened to employ people who were undocumented. So in the middle of the night, they come in, she's cleaning the floors at Sikorsky, and she gets arrested and basically taken to prison, in an attempt to take her back to Colombia. She got fled Colombia in the midst of drug violence. She was there with her husband. And she was crying. And when I asked her why she was crying, because it didn't sound like she had any kind of, psychiatric problems. I mean, she was upset, like you would be, but it was difficult to understand, why was I being called to this? And so when I talked to her and I said, tell me a little bit about what's going on, she told me something that had stuck with me up until today. And I think it represents a lot of what we see when we talk to our Latino patients. What she said was something along the lines of, I was a teacher in Colombia. I left because I was going to be killed and came to the US with my husband. We are very poor. We take care of each other. We have a very small little 1-bedroom apartment in Bridgeport, Connecticut that we're renting. We barely make ends meet. And at night, we go clean Sikorsky helicopters. And things are rough. But when I come home at night, after a whole shift, and we're very tired, I hold my husband's hand, and that's all I need to be okay again. The importance that this woman was actually placing in that was tremendous. And what she actually what was going on at the time when I was seeing her is like the resources, the coping mechanisms that this amazing woman had actually used throughout, her traumatic experiences, which was the connection to somebody else that was basically somebody she loved, was not there anymore. And she was basically appeared like she was crumbling. She was not. She was actually very, very strong. And I think that's something that we keep in mind, and we should always keep in mind when it comes to our Latino patients. There are some things that our Latino patients have, particularly when it comes to mental health, that are super, super, super important. What do they want? What do our Latino patients want when we see them? Well, we know what they want. They want us to listen to them. We know they want us to value their cultural heritage, and they want us to be. They want us to respect that. So those are some of the things that basically drove me to KP. Basically, the fact that we are an integrated care system with focuses on personalization, and we provide extremely easy access to healthcare. So again, as I said at the beginning, we don't think that you need a constitutional mandate to receive mental health treatment. Everybody should be able to receive mental health treatment, no matter who you are. And so that's basically what we're trying to do within our organization. So what are we doing here? Well, we know that despite all the efforts that we're making, significant barriers exist for our Latino patients and for our minority patients, but particularly for more Latino patients, to access and maintain care. We know, for example, that Latino men and women don't stay on antidepressant medication just as long as Caucasian people. We know that they're less likely to renew prescription medications, and we know that that can lead to a different outcome when it comes to recovering from mental health conditions. And that's just one little thing. Throughout the day, you will hear more about that. So what do we do to basically go about solving those? Well, we have a number of systems that we have implemented. We have something called Connect to Care, where people can very quickly call a phone number and connect to a full intake that allows them to receive or start receiving mental health care. We also have a program called Virtual Adapt, where we provide population management for depression and anxiety to many patients, ensuring that more people are able to receive the treatment that they need. We're also making huge efforts to hire the best people from all sorts of backgrounds to continue providing high quality mental health care. And we're also building on our language services. So overall, I'm tremendously optimistic about the future of our organization, about our commitment to take care of our Latino patients. And you will hear a lot of these things today. I'm very, very grateful to have been invited today, and I look forward to meeting more of you later in the day. Thank you so much.
Thank you so much, Dr. Temporini. We appreciate you.
Okay, let's go ahead and again, miles de gracias, Dr. Temporini. Just a special shout out to Dr. Temporini is always presente and engaging with KPLA and other BRGs as well, just to elevate the importance of equity inclusion in the space of mental health and wellness. So miles de gracias otra vez, Dr. Temporini, for joining us today and sharing more about you. Okay, so let's go ahead and move to our next presenter, which I will be introducing here. In one moment while I pull up my notes here. And thank you everybody for joining us today again. We appreciate everybody's engagements here. Okay, so let's go ahead and introduce Dr. Dan Gizzo. And Daniel Gizzo is the California Director for the Kaiser Permanente Mental Health Scholars Academy. Super excited about that, by the way. In this role, Dr. Gizzo leads the statewide implementation of an initiative to create opportunities for Kaiser Permanente employees to pursue master's and doctorate graduate degrees in mental health fields. Dr. Gizzo is also a clinical psychologist specializing in clinical work with children and adolescents. He is a graduate of the California School of Professional Psychology and is licensed as a psychologist in California and New York. Dr. Gizzo previously worked for 16 years as a clinical psychologist with the Southern California Permanente Medical Group in San Diego. He has experience providing a variety of clinical services in an HMO setting, including pediatric neuropsychological assessment, autism developmental assessment, and assessment of ADHD. He is the former training director for the APA accredited Kaiser Permanente medical care program doctoral internship in clinical psychology in San Diego. Dr. Gizzo remains active in training mental health professionals and providing continuing education programs. Dr. Gizzo's clinical interests include evidence-based treatment for children, treatment of Tourette syndrome, clinical implementation and outcomes research, and feedback-informed care in psychotherapy. And with no further ado, let's go ahead and welcome Dan Gizzo.
Thank you, Michelle. Appreciate the introduction. I'm just going to get my screen set up to share some PowerPoint slides here. So good morning, everyone. And thank you, Michelle and Jessica, for inviting me to speak at today's summit. I'm really excited to be here today, learning alongside everyone with a great set of workshops to look forward to in today's program. As Michelle said, I'm the California Director for Kaiser Permanente's new Mental Health Scholars Academy. I'm going to take a few minutes this morning to tell you a bit about our new program and our goals and what we're doing. So our Mental Health Scholars Academy is a division of the Kaiser Permanente Scholars Academy, alongside the current Northern California Nurse Scholars Academy and a future Allied Health Scholars Academy. I'd like to recognize Dr. Jim DeAlfonso, our Executive Director for the Scholars Academy, and Ann Williamson, Vice President for Clinical Integration at KP and our Executive Sponsor. For those of you who are not Kaiser employees in today's audience, Kaiser Permanente divides California, the state, into two regions. We've got a Northern California region that includes the San Francisco Bay Area, Sacramento through Fresno. We have a Southern California region that starts in Kern County and Antelope Valley, goes through the Los Angeles metro area, Riverside, Inland Empire, Orange County, and down to San Diego, where I work out of. And one of the important characteristics of our Mental Health Scholars Academy is that we're a statewide program. And so we work across both of Kaiser Permanente's California regions. The mission of the Mental Health Scholars Academy is to support academic preparation and lifelong learning for mental health professionals, from students to trainees to experienced professionals. We do this through a combination of our direct initiatives, as well as through collaboration with our Kaiser Permanente mental health training programs in both California regions. Our direct initiatives include academic degree programs for master's and doctorate degrees in mental health fields that we make available to our Kaiser Permanente employees through partnerships with universities. A bit more about who we are as an academy. We're a transformative initiative with a goal of addressing projected workforce shortages in mental health professions across California. We'll be supporting hundreds of eligible employees in our degree programs, where we provide opportunities for Kaiser employees to earn master's and doctorate degrees in mental health fields of study, essentially a chance to change careers. One of our key areas of support is the tuition assistance we provide. Accepted candidates to the Mental Health Scholars Academy become eligible for 75% tuition support at participating academic programs. We're also focused on increasing diversity in the mental health workforce, looking across a wide range of intersecting identities, and also to help promote linguistic, ethnic, and minority representation in mental health professions. I'd like to take a moment to highlight some of the healthcare workforce issues here in our home state of California. We know there's work to do with regard to representation in the overall health workforce across the state of California. For example, the California Future Health Workforce Commission stated outright just last year that California's healthcare workforce needs to better reflect the diversity of its communities with respect to race, ethnicity, gender, sexual orientation, and socioeconomic status. Further, California's Latinx population make up the state's single largest ethnic group, projected to reach 41.5% of the state's population by 2030. But we do not see that same level of representation in the health workforce, and particularly in the mental health workforce across the state. If efforts are not made to break down barriers and facilitate representation in the workforce, these gaps will only become more significant over time. The Latinx population, along with African American and Asian populations, are underrepresented among graduates of mental health education programs relative to their percentage of the state's population. We also know that the Latinx population is underrepresented among our state's psychiatrists, psychologists, counselors, and social workers. As we look at these demographic trends, we can call out the gaps, but we also have an opportunity to identify possible solutions. We can create initiatives to support entry into the mental health workforce, and we can build pipeline programs to help facilitate opportunity. We can also work to make mental health professions a more welcoming professional space for individuals for underrepresented groups. For example, we can anticipate the expected growth trends in our population in different parts of the state, as we see here in some projected trends for our Kaiser Permanente California regions. Now, we realize these statistics are broad strokes and fall victim to overcategorization. We know the Latinx and Asian populations are not homogeneous. However, we can look further into the demographics and look at the targeted areas of needs. For example, in mental health, we can engage planning to meet the future linguistic needs of our patients. Therapy can be more personal and more powerful when delivered in the preferred language. We anticipate linguistic needs in the Spanish language in California for certain, but we also see significant need for American Sign Language, Mandarin, Cantonese, Vietnamese, and a variety of other languages. For example, a recent study found that 12 million Californians speak Spanish, Vietnamese, Filipino, and Thai or Lao at home, yet physicians speaking these languages are all underrepresented in California's workforce. Again, if unaddressed, then over time, these gaps become more problematic. Multiple benefits have been identified when we increase diversity in our healthcare workforce: improved access to care, enhanced provider choice and patient satisfaction, better patient to provider communication, and better experiences for students and trainees. But I think there's another important benefit. Last week, we heard Dr. Don Mordecai, KP's national leader for mental health, speak about disparities and the resulting distrust in the healthcare system. We believe that increasing workforce diversity can help increase the trust in the system. We can create opportunities for communities of color to have a different experience in our mental health system and begin to change the disparities and build trust. We can make mental health spaces more welcoming for communities when there's better representation and when people can have an increased opportunity to see others who are like them in some way when they come in for care. So getting back to the Mental Health Scholars Academy, we set out to build a pipeline for new mental health professions within Kaiser Permanente to help address our projected workforce shortages and increase demands for mental health services. But we started with an aspirational goal, not just to build a pipeline, but to help build a California mental health workforce that's as diverse as the communities we serve. We're contributing to this goal by creating opportunities for Kaiser Permanente employees to move into mental health careers by enrolling in graduate degree programs and receiving tuition support, mentoring, connection and networking, and educational opportunities. We had our soft launch earlier this year when we recruited for 40 participants at 2 partner universities, participants working towards master's degrees and eventual licensure as marriage and family therapists. We recruited Kaiser Permanente employees who already had a bachelor's degree and who had interest in transitioning into a mental health career. And the response was really overwhelming. We had 185 completed full applications for our 40 initial slots. Our employees needed to apply to our program much in the way they would later apply to the universities. They completed an application form and submitted application materials for review. How we built our program was to start out by consulting with our equity, inclusion, and diversity teams at Kaiser. We reached out to Tara Ang, our Kaiser Permanente regional lead for EID. We also introduced to Michelle Linares, one of today's summit leaders, who happens to also now be on our Mental Health Scholars Academy Advisory Council, and we're grateful for her support. Our team put together an objective system for our application reviews. We trained our review teams on EID principles, and we had them all complete unconscious bias training. And we made sure that every applicant received at least one full review on our objective system. Our candidates were chosen and then moved on to the next step by applying to our partner university programs, where they had to meet the full admission criteria of the schools. All of our cohort earned admission at the universities. We then went back and evaluated our results when we were done. Here's what we found. With 185 applicants, we only had 40 spots. We ended up accepting the top 10% on our objective 20-point scale. While a little over a third had undergraduate degrees in psychology, almost 2/3 did not, and were truly changing career fields to an area where they had not studied previously. While our goal for GPA was 3.0, most graduate programs set the bar at 3.0 undergraduate GPA for admission. We arranged for allowances with our university partners for applicants with below a 3.0 GPA on a case-by-case basis. And 40% of our cohort group gained admission with a GPA below 3.0 from their undergraduate. 36% were bilingual, Spanish being the most common language of the group, but 6 other languages represented as well. We had a wide range of tenure with some longtime Kaiser employees as well as newer employees joining our cohort. We found that a full 85% of our cohort had endorsed the diversity variable on our supplemental survey. And with regard to race and ethnicity, people of color made up 80% of the cohort. We felt that this outcome was in line with our aspirational goal of increasing diversity and representation in our mental health workforce. Some of our cohort members were recognized and featured in Kaiser Permanente's online news portal, Inside KP, with stories about going back to school for mental health degrees. Quincietta is earning a second master's degree and has been one of our enthusiastic participants in our Northern California cohort. As the article highlighted, some of our cohort members came from related fields, and others were moving from fields such as finance, information technology, business consulting, clerical services, and now taking the first step towards transitioning into our new mental health workforce. We were inspired by their stories and their enthusiasm for helping others in the mental health field. Maritza is a member of our Southern California cohort. And I really just love the quote that she gave the article here. I know my life's greatest work will be in learning from and working with clients. The simple truth is that we're in this together. It's evident in our circles, families, and communities. At the core of our being, we thrive through connection. I really could not say it any better. We learn from our clients and we learn from working with them. Maritza really highlights the concept of lifelong learning here, and this brings us back to our Mental Health Scholars Academy mission of advancing lifelong learning across the continuum from students to trainees to experienced professionals. Much like we're all doing here today, gathering as a community. We're gathering as a virtual community today, but a community of students, therapists, medical professionals, allies, and community leaders to learn together and advance our understanding of mental health issues. So what have we learned in launching the Mental Health Scholars Academy? We learned there's high interest in mental health careers, and perhaps that's a good sign of decreasing stigma. We've learned that those who are interested in becoming mental health professionals bring diversity in their backgrounds, prior careers, race, ethnicity, gender, and many other identity factors. We know that there are real barriers to entering the mental health field. Graduate degrees at private university programs are more available but higher cost. At public university, costs are lower, but program capacity can be a barrier. We can create programs like ours to help address some of these barriers. Most importantly, we've learned that in launching the Mental Health Scholars Academy, addressing diversity takes intent and action. You can't just build a program or offer a scholarship and then sit back passively and hope to improve diversity and representation in the workforce. You have to work at it and find ways to make the program welcoming and inviting for applicants while simultaneously addressing barriers. Our Mental Health Scholars Academy is only a small piece of the solution in the state of California, but we're excited to do our part. We look forward to our next steps, which include expanded mental health graduate degree program opportunities for Kaiser employees who are going to begin classes next year in the fall of 2021. We look forward to reaching 175 new participants in the coming year. For more information, Kaiser Permanente employees can visit our website at kp.org/mentalhealthscholars. For the non-Kaiser attendees in our audience today, unfortunately, our public-facing site is not quite ready. It will go up in early 2021. We're still a very new program and still in the active building stage. I want to again thank Michelle, Jessica, and the entire KPLA team for putting together today's event. And I really look forward to learning alongside everyone in today's workshops. Thank you.
Thank you so much, Dan, for your overview, presence, and just sponsorship overall. I would say it in Dr. Jennifer Mullen's words, you're not only an ally, you're an accomplice, really, to help us diversify our mental health workforce and training programs and everything that is needed to advance equity and social justice in this space. So thank you so very much for that. And let me bring up the slides here and get us going. Okay, so I will have, let me move this along here. And welcome back, Beatriz Rojas. And if I can have someone put a spotlight on Beatriz, we're super excited to have her here, part of day 2 as well. And let me just introduce Beatriz here. Again, for some of you that are just joining us here on day 2, this is your first time. Beatriz Rojas is the National Senior Director for Multicultural and Mental Health and Wellness Marketing at Kaiser Permanente. Her mission is to influence the organization to ensure Kaiser Permanente is inclusive to the diverse member base and communities it serves. Beatriz has a wealth of marketing experience, which includes multicultural marketing at Sears Holdings Company and IBM Company, at the global level in marketing programs targeting emerging countries. An ongoing challenge in her role is to deliver on a corporate strategy while embracing the cultural differences of each audience, country, or region. Beatriz strives to plant a seed of curiosity and sensibility in all audiences and continue to strengthen the efforts to reach, connect, and empower the multiple diverse communities, break bias and stereotypes, and contribute effectively in closing health disparity gaps. She is a native from Caracas, Venezuela, and currently lives in Oakland, California. Beatriz holds a BA in computer science and an MBA in marketing. So please welcome back Beatriz Rojas.
Hi, good morning. Buenos dias, everybody, and happy Friday. It's my pleasure and honor to be here with you again. And what a challenge to follow our 2 great speakers and to continue the journey to increase and improve our mental health and wellness among our Latinx community. So I'm here to share also another aspect of the work that we have been doing at Kaiser Permanente in this journey. So if we go to the next page, Michelle, please. We heard a little bit about the healthcare access from Dr. Temporini, and I wanted to bring it a step back and let's talk about healthcare access in general among our Latinx community. We know that health and healthcare, it's really a 2-way relationship, right? The better the healthcare that we have, the better health that we will have. The better health that we have, the better healthcare outcomes that we will have. So it's a 2-way relationship. So imagine the impact on health when our Latinx community is still 1/3 more unlikely to not have insurance as compared to a non-Hispanic white. So there's still a big gap in the basic of access to healthcare. There has been progress done. Obviously, the Affordable Care Act was a huge improvement to provide access to healthcare to our Latino communities, and we saw how the Latinos sign up and we increased those rates. So it was a good win for all of us. However, with the COVID-19 economic recession, it has disproportionately impacted our Latino community. There is around... I think there is a question or a comment. Okay, I heard some noise, so sorry about that. What I was saying is that almost 40% of Latinos have someone in their household that has lost their employment. And of course, when you lose your employment, you very likely will lose your healthcare coverage as well. So this has had a disproportionate impact in the access of healthcare for Latinos. We know also, and Dr. Temporini and Dr. Gizzo spoke about it, how the cultural barriers also can make the healthcare system even more complicated and less accessible for our Latinx community. Especially if you're an immigrant, you're not very familiar how the system works. You don't even understand how the words and the different nuances, how to apply to it, what you need to do, that you need to renew it every year. So it's a very complicated process, so even more complicated if you are not used to the system. And imagine if you add to that the layer of language, where you don't even understand the words that they're saying, so it's even much more complicated. If we move to the next slide, Michelle, please. Then how do we translate that, or what does it mean for the mental health challenges, specifically for access among the Latinx community? And we heard a little bit about this already. Stigma, we spoke about that last week heavily. Stigma and the lack of understanding in our Latino community is a huge barrier. We have done progress and we have been working on addressing that, but there is still a long way to go. We know that it's a taboo. We feel embarrassed. Those things you don't talk about your problems or your depression or your issues with others, you keep it at home. So there's a lot of stigma still around our community, and a lack of understanding even on what are the mental health conditions that need to be treated and how they can be treated, and they can get better if you treat them. In addition to that, a very sad statistic that the Latino children and adolescents, they experience higher rates in depression and suicidal behavior than the non-Latino peers. And my friends, very sadly, this is especially true among our girls. Our Latina girls, they experience high rates of suicidal thoughts. If we add to this what we were talking earlier today as well about the impact of being an immigrant, where you have limited English proficiency, you don't know how the system works, you're bringing some challenges from your country, some trauma, maybe on how you left your country. We heard the beautiful story from Dr. Temporini. So you underutilize the mental health system because you don't even know that it exists or how to access it. So this results that only 1 in 10 of our Latino communities is approaching the mental health professional to seek for help. And 1 in 4 have no insurance at all. So this is a very dramatic situation that it's good that we're taking actions about it, but it's very complicated. And in addition to this, then we add the COVID pandemic of this year, where we all know that the Latinos are in a higher risk of getting the COVID virus, getting sick, and even twice as high the death rate. So this is obviously a consequence of a long-standing inequities in the health system, but this is bringing a huge level of stressor in our Latino community. We know that being in a stressful situation impacts also your health and your, so it's like a vicious circle, right? We are more stressed, then we weaken our immune system, so then we get sick. This death toll is also having a huge impact in the depression of our communities. When you're losing dear people, you're losing family members. In many cases, you cannot be with them. So it's a big impact on your emotional well-being and your mental health stability. As we mentioned before, the economic stressors are heavily impacting because you need to take care of yourself and your family, and you don't have food to put at the table, and how to address that. We know also that many of our Latinos are essential workers. So we know that that has been taking a huge toll. on the pandemic itself, and also imagine the ones that have a job and also have kids at home. How do they balance the two things? So it's huge level of stressors that we're seeing right now increased in our Latino community. But let's go a step further away from this and let's see what Kaiser Permanente is doing. So if we go to the next slide, please, Michelle. We heard a little bit this morning from Dr. Temporini. What are we doing from the care delivery side and how are we trying to address that? But we know that there are many other ways and surround sound, if you will, that we can help support the mental health and the well-being of our patients, our members, and our communities at large. And supporting prevention and early intervention, it's very, very important. Similar to the physical health, we know that the earlier that we start addressing our mental health issues, the better outcomes we might have. The earlier that we recognize and address that there is an issue, the more that we can prevent it and hopefully address it at an earlier stage. So for the last 4 years, or even a little bit more, a group of very, very smart and dedicated people from the Innovation Center in the Care Management Institute, under the leadership of Esther Newith, they have been working on a project called Project Kamai, that maybe some of you have heard about this, but just in case, it's an amazing initiative to provide self-care digital tools and resources for our patients, our members, our customers, and our community at large, so we can support our emotional wellness. It has been a huge endeavor, a cross-functional team from many different groups across Kaiser Permanente, including, again, the Care Management Institute, the quality team, our mental health care leaders across all the enterprise, the KP.org team to really host and pull up these tools in KP.org, the strategic customer engagement on how do we make key partnership to have these tools there, and also our marketing team, which I'm very proud to be part of, on how do we promote them and how do we make them available and how do we get the word out. So in KP.org, you can find a very robust range of self-care resources, including audio activities, articles, videos, and much more. And they are designated to help you manage your stress, sleeping better, parenting support, meditation, mindfulness, and many more. And we even have 2 very well-known apps that we are offering at no cost for our members. And we have My Strength and Calm. And again, they are at no cost for our members. So hopefully you are taking advantage of them. So this is a very, very powerful aspect that we have on supporting, again, prevention and early intervention. So you will say, okay, this is all great, but what are we doing for our Latino communities? Granted, we know that many of them speak English, but what else could we do? So if we go to the next page, you will see that this year we embarked a huge odyssey of really transcreating these digital self-care tools into Spanish language. And I say transcreating because, as you know, it's not just a word for word that we can do this. We needed to be very thoughtful on how we approach this content, and even more complicated when we're talking about audio or video or even the apps. So how do we do it? So I'm very proud to say that the team, really led by Vicky Lilash and Marisa Jimenez, embarked this journey, and we have over 100 pages now available in Spanish language. They offer a seamless experience for our visitors, our members, and consumers that prefer Spanish language, so they can really take advantage of all these tools. And I'm very proud to say that this is one of the most robust Spanish language self-care destinations that we have here in the United States. I'm very sure there are many others in the world, but here in the US, we are leaders, guys, and we have a very robust set of tools in Spanish language available to our community. So we had some customer-facing toolkits that supporting the promotion of this, because of course, once that we have them there, what do? We need to make sure that we invite people to come and use them and that we promote them across our communities. So we developed a very robust direct marketing campaign targeting our Spanish-speaking members. And we did some mailings, some emails, even texting, and we have been very aggressively promoting it across our communities. Granted, this year it's being a bit more complicated with all being digital, but still we have a very, very robust campaign that we have been running throughout this year, touching more than 200,000 members in Spanish language, promoting these tools and inviting them to use them. So if we go to the next page, Michelle, again, we know that with COVID, it's even much more important that we have these tools and we take advantage of them. We heard from Dr. Temporini, how are we addressing the care delivery? Then we heard from Dr. Gizzo, how are we addressing the pipeline and making sure that we have more and more diverse people serving our members. And this is also another tool that we're putting in their hands so each of them can take care of themselves when they are not in front of, you know, a caretaker. So what can we do? What can we do also? We are the change. So if we go to the next page, Michelle, we need to meet the moment now more than ever with COVID and all the unfortunate toll that it has taken in this community. We need to make sure that we meet the moment by taking care of ourselves, adopting the tools, and also making sure that we promote them and we share them with our colleagues, our loved ones, our neighbors, our friends, our amigos, familias. Let's take advantage of this and let's take care of ourselves. And also, please be safe in these coming holiday seasons. We know that family is extremely important for us. Being with our loved ones give us our emotional support and well-being that we all need, but we need to be very safe this year. So let's make sure that we find that balance on how are we supporting our emotional well-being, being with our families, and also taking care of ourselves. And I wanted to close my conversation today with a little video that we also have available in Find Your Words that we talked about it last week. And I just wanted to share it with you on how to take care of our children's mental health. That is such an important part of our family. So with that, I'll leave you. And Michelle, if you don't mind showing the video.
Yes, let me go ahead and make this a full screen.
As parents, supporting our children's mental health is one of the most important things we can do, but many of us don't know where to begin. These 3 tips are a great first step. Talking often and honestly, especially about your own struggles, is an invaluable way to help your kids identify what's normal and what's not. Try having your first conversation about mental health as soon as possible, because that will make any future conversations much more comfortable. If possible, these discussions should happen in a distraction-free space. Remember to listen much more than you talk, and stay supportive or neutral, even if your child says something you find alarming. Most importantly, let your kids know you'll always be there for them. Teaching your kids good habits like mindfulness, meditation, and exercise are essential to their daily self-care. In fact, you should participate too, because when you work on your own mental health, it will be easier for your kids to learn from you. Practicing positive emotions like love, gratitude, and compassion can help your kids recover from hardships faster. Most importantly, always remember to show your children empathy. Acknowledge their feelings, because sometimes they may feel relief simply by being able to share their struggles with you. Explore findyourwords.org to learn more about helping your children with their mental health.
Thank you again, Beatriz, for providing a part two just to the amazing work that you're doing at Kaiser Permanente with all of our functional partners, just to have the right tools, communication, and not only translation, but transcreation, because it is an art. You know, we cannot just have a direct translation from English to Spanish, but we need to carry over those cultural nuances. And so we thank you again for just the amazing work that you're leading and helping partner across Kaiser Permanente and even external partners, and always being a support and advocate for KPLA and other business resource groups to leverage our experiences and serve as cultural brokers to these projects as well. So miles de gracias otra vez, Beatriz, for your work and again being part of this summit. Thank you.